That's my day right here.
Yeah.
Plans this weekend. Anything going this weekend?
I don't know. We haven't talked about it yet. May go to the lake. It's gonna be nice.
Hot last Saturday.
It's terrible. That's fried. That's redder than this shirt.
Let's go to a wedding shower.
Yeah, I'd probably be better off there.
Ready?
Yeah.
Ready, Jeremy?
Yep.
Call meeting Crawford County Commission to order Friday, June 12th. Again, flag salute. Pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Had a chance to look at the previous meeting minutes and corrections.
Mr. Chairman, I move we accept the minutes from the previous meeting.
Second.
Aye. Moving on to signing of the motions.
Yes, we had 4 motions from the last meeting to sign. The first motion is 20-242, that the consent agenda be approved. The second motion is 20-243, to adopt resolution number 2020-010, a resolution amending resolution 2016-006, dated February 16, 2016, which created an active transportation advisory board. The next motion is 20-244, to approve a total payment of $2,681.35 to Crawford County Rural Water District Number 2 due to issues from the Crawford County Sewer District Number 3 Force Main Relocation Project. And the last motion is 20-245, to recess this open session and go into a closed executive session for a period of not more than 10 minutes to discuss an employee under non-elected personnel and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 11:46 a.m.
Thank you.
Thanks. Thank you, Donald.
Okay. Moving on.
Thank you.
Rebecca, how are you today?
Good.
You want to bring us up to date with
Sure.
what's going on?
Okay, so we have had some more cases this week, and I've been putting out press releases on those. And then this morning, we have 3 new cases. So
Oh.
I have not sent out a press release because I haven't had
That's
time.
on top of the 6 yesterday?
Yeah, this is 3 today. So 3 new ones today. So I'm hoping that people are watching on YouTube because we had a lot of questions on Facebook. I haven't had a lot of time to answer all of those, but I did answer some yesterday. And so I did post on Facebook to jump on YouTube today and watch the meeting because we're going to discuss. So if it's okay with the Board of Health, I'd like to go over some of those questions just for
Yeah,
those
sure, of
watching.
course,
I
yeah.
think it would be helpful, you know.
Yes.
So there's a lot of questions around who's a contact. So a contact of a positive case would be anyone who lives in the household is considered a contact. And then anyone who's been within 6 feet for 10 minutes of that person who's positive for COVID-19 while the person was ill or for 48 hours before they became ill. If they're asymptomatic, which we've had a couple of folks test positive with no symptoms, and how that happened was the hospitals are testing people before they come in for procedures, and they just happened to catch 2 that were positive with no
Really?
symptoms. The health department does not typically test asymptomatic folks, but anyways, so if a person has no symptoms and they test positive, we consider them infectious 48 hours before the test was done because they had no symptoms. And if you have symptoms, you're contagious 48 hours before the symptoms started. So, but you have to be within 6 feet for 10 minutes of the person who's positive. So if you work with somebody whose spouse was positive, you're not in contact with the positive person, you don't have to quarantine. You actually have to be in contact with the person who's positive or live in the same household. There's been a lot of questions around closing a food plant in Crawford County because of some positive cases, and we would not close a food plant. They are considered an essential function under the Kansas Essential Function Framework. So,
Does there come a point, if we keep seeing these numbers on the rise coming from a specific plant, is there a point when we finally deal with that?
we already are dealing with
Oh,
it.
I mean, I know you, I know.
Yeah.
I didn't know if there was anything above what.
I'm already, and that was some questions on Facebook, what are we doing about it? So this week, immediately, we had a conference call between the food plant and Kansas Department of Health and Environment and myself. So the state epidemiologist was on that call. I asked a lot of questions about testing the entire plant, and that is not recommended to test asymptomatic people. Of course, anyone with symptoms we want to test. What KDHE is directing us to do is isolate and quarantine anyone who was in contact with a positive, and of course, the positive person's isolated as well. So it's not recommended to test asymptomatic people or those without symptoms, and that kind of just goes back to like you wouldn't go in and get a rapid flu screen if you didn't have signs or symptoms of the flu. There's no test that is approved for testing asymptomatic folks at this point. So the false negative rate is high. You're probably not going to get very many positives from testing asymptomatic folks. Now, every now and then you will luck out and get one, which we've seen, but it's not recommended right now. And then also, the plant discussed all the things that they're doing to prevent the spread. So they are being very proactive to prevent the spread. They're following all of the CDC guidelines and KDHE guidelines and Department of Ag guidelines because it's food processing. And I will say in Southwest Kansas, they've had hundreds, like
Right.
1,900 cases, and those food plants have not been shut down. Now, other states have shut down some food plants, but they have different guidelines that they follow. And if a plant there have been plants in Kansas that have chosen to shut down for cleaning or whatever, deep cleaning for 2 days or 48 hours. But as far as I know, none were shut down by any governmental entity. And I think that's important for people to be aware of. So yeah.
Rebecca, you had mentioned that you had volunteered to test all the employees.
Yes.
And
I
there
offered
was
that.
no interest in that?
Not at this, Sugar Creek declined on that at this point. I was in contact with the Community Health Center of Southeast Kansas. They were willing to help coordinate that, so I offered it, and the offer still stands. I will just,
Why would they not be interested in testing all the employees?
I have no idea.
I mean, that would be,
I don't know. Well, and I think it falls back to, there is no recommendation to test asymptomatic people from the state health department at this time. So it's not medically recommended at this time. Now, there's a lot of controversy around that issue from medical personnel throughout the country and the world.
Like you said, in southwest Kansas.
They're not testing their entire factory either.
Right.
None of them have.
They've got 1,900
Right.
cases, so.
Yeah, and that's why I
If
offered
you can
it.
nip it before that, why would you
Yeah.
Why would they not want to do that? I don't
Yeah.
understand that.
I do not know. And their corporate office was on the call, the corporate from the Ohio corporate office. But the offer still stands. I will just throw it out there that we've tested quite a few of their employees. And the Community Health Center of Southeast Kansas is also testing and has a drive-through testing center just set up in the Community Health Center parking lot. And they are testing asymptomatic folks that want tested too. They send to a private lab so they can do that. And typically we send most to the Kansas Health and Environment Lab, so they will not accept tests of those without symptoms up at the state lab. We have tested several that are asymptomatic and we can send to a private lab. It's just that on that front, we don't have unlimited funds to be able to
Sure.
do that for thousands of people. So, and there's controversy around whether insurance will even pay for that if there are no symptoms. So, I encourage anybody that wants to get tested. Call the health department. We typically, they do need symptoms to be tested. We can work something out. If they have insurance, we can try to file it. And we can work something out for, a certain number of people, but also the Community Health Center is willing to do the tests, whether they're symptomatic or asymptomatic. So by all means, you can also go to the Community Health Center in Pittsburgh. So anyway, that's kind of the around the closing of the plant, because there were a lot of questions on Facebook as to why the plant wouldn't close. The plant has approximately 580 employees, and they have employees that do not just live in Crawford County, so or Kansas for that matter. So the cases we are counting on our count are Crawford County cases. Now the plant itself has cases that maybe don't live in Crawford County, but we are aware of those as well because we have to isolate and quarantine anyone in contact with any of those cases. And I will say that the plant has been very cooperative on getting us all of the information that we've requested. We have not had an issue with that. And then there have been questions as to why we wouldn't just put the name of it out there. I'm pretty sure everybody knows where it is. It's because their own employees are posting it on Facebook. The state does not release the names of businesses or long-term care facilities, for that matter, typically that have cases. And, I'm not planning to do that because, we would have to do that for every business, whether it be large or small.
Right.
So if you have a small hometown business, that could be detrimental.
Sure.
People may quit going there, period. I mean, they just be like, well, let's not go there anymore. And it could be detrimental. I mean, it could be detrimental for a larger business, but probably not on the same scale. And then I've had a lot of questions asking why we don't state if people went to Walmart or Dillon's or Home Depot or whatever grocery store. And the fact is that unless a person who's positive tells us they were within 6 feet for 10 minutes of a case, of another person, then they're not considered a contact. And once again, if we have small businesses that we put out, there was a positive COVID-19 case that was in a business for 5 minutes, I mean, people may not go there, and that could be detrimental to their business. And so what I'm encouraging people to do, if you're high risk, and we've had that concern on Facebook that, well, I'm high risk and I need to know, and other counties can state that if they want to. I'm not going to, because it doesn't serve a true purpose other than people just won't go to that business then.
Right.
And so what I'm encouraging folks to do is to realize it's in Southeast Kansas. All the counties around us are having increased cases just like us, and it was to be expected after things opened up. So if you're gonna go to the grocery store, you need to take your public health precautions, wear your mask, socially distance, wash your hands. If you're high risk, I know for sure Walmart's still doing curbside pickup. They always have, even before the pandemic. And I think some of the other local grocery stores are still doing that as well. I think Ron's IGA is. I don't know about Gerard, if their grocery store's doing the, the online curbside pickup. So I think people just need to realize, I mean, if I say a certain store like Walmart or Home Depot or Dillon's or whatever market it is had a case, are you never going to go to the grocery store again? Right. I doubt it. I mean, so it's not effective and it's not necessary. So you need to realize it's out in the community and you need to take your precautions regardless. We're still recommending people follow the Ad Astra plan, and we're in phase 3, and that's on our county website. And let's see. And then the other thing to remember is we're following the metrics. So, because I've had some concerns, mostly this is coming from social media, that why aren't we closing things down and this kind of thing. So, and when I say we, myself and the Board of Health is what I mean. We just need to remember the 4 metrics that have been set forth by KDHE for us to follow. That's if we have an increase in deaths, and that would be a significant increase. Ability to test, we're still able to test. We have large-scale testing capacity. Our hospital capacity is very good. There were 2 people in the hospital in ICU. They're no longer in ICU. They're doing very, very well. Our ability to isolate and quarantine, we're having no problems with that. So until we're not able to meet those 4 metrics, I'm not going to recommend that we become more restrictive. Because those are what we're supposed to be following for public health purposes. I had a question, well, why in the beginning did we become more restrictive? Because we didn't have any of this stuff in place. There weren't testing capabilities yet. We did not even really have a case definition for isolation and quarantining in the beginning of this pandemic. The hospitals were trying to prepare for patient surge, and their surge capacity wasn't where it is now. So anyway, that is why and even on the state press conferences, Dr. Norman has stated yesterday, he had that same question, why so much in the beginning and not as much restriction now? And he said the same things. We're just more prepared. We've had several months
That
to
was
get
my next
ready.
question.
Yeah.
If it takes off here, like we're seeing numbers on the increase,
Right.
do we have a plentiful supply of test kits?
Yes, we have lots of test kits at the health department. Community Health has lots of testing kits. They've tested already over 100 people just in the last 2 days. So we have plenty ability to test. So we're meeting all 4 of our metrics. And Dr. Norman has indicated on our KDHE daily webinars that the state has plenty of testing capacity. Most private offices and Community Health, they send to private labs. And that's another thing. In the beginning, none of the private labs had the ability to test. It was just KDHE. So that is why public health restrictions were so strict in the beginning, because everything was so limited in the beginning. But now we're much better prepared. And we have to remember the incubation period is 14 days. So I have no doubt that even over the weekend and next week, we're going to see more cases, because we're getting, actually literally this week, several hundred people tested between the health department, both hospitals have tested, and Community Health. So we're going to get more cases, I have no doubt, this week and next week, over the weekend and into next week. And then, our hope is, hopefully then it'll start to plateau, because the incubation period, the 14-day incubation period from that first exposure will, be coming to an end. So I do want people to call the health department with questions. We're getting lots and lots of phone calls. So I would just request that maybe people don't call ranting and raving that we should shut down a food plant, because we're not going to do that. We can't do that. They're an essential function. So our epi nurses are trying to contact people who need to isolate and quarantine. It's not that we don't want to answer questions, but I realize people are scared and worried and upset, and we all are, and it's totally understandable. But really, if you want tested, if you have serious health concerns, we want to answer those questions, but we just need for people to realize that these numbers are going to go up. These folks are not severely ill. They're isolating, they're quarantining, and not all of our cases are in association with a food plant. So there were some posts on Facebook, this is all the food plant, and it's not. We have cases that are not associated with that. So, and like I said, we had 2 asymptomatic people that had nothing at all to do with any of that. So just please realize that it's not all related to that. Joplin, I saw in Jasper County, they had a press release on Facebook yesterday. They're up to 74 cases. So, this is happening across the country because things are starting to open up. But we're lucky in Crawford, our patients are not severely ill. You know, everybody's pretty much, except for a couple, are at home getting better, isolating and quarantining. So how about any other questions?
I wanted to, because I guess I'm still not totally understanding KDHE's not wanting to test all the employees there. Like I can maybe see, like, obviously not an epidemiologist, right? Like the science
Right.
behind testing asymptomatic
Mhm.
people, but it seems like if we have a known outbreak,
Right.
which is how that would be defined, like,
Mhm.
why would we not want to contain and pinpoint as much as possible?
Well, part of it too is, and there's some confusion around that, because KDHE will, if there's an outbreak in a long-term care facility or nursing home, they will test that entire facility and the staff because of such a high-risk population, and that's really where we've seen the deaths is in the elderly. But there's just no actual approved test for asymptomatic folks. So
Why is that? Like, what's
the FDA has not approved a test for asymptomatic folks. The FDA has not
That
approved
it's less
one.
accurate, or?
Exactly, yeah. Well, and there's a lot of criteria around efficacy of a test, like a percentage. Like if you tested 100 people without symptoms, it would have to have a percentage that actually picked up a positive out of those people. I don't know the exact percentage, but the test, the nasal swab, the nasopharyngeal swab is not reaching that percentage to be FDA approved to test asymptomatic people. So that is the reasoning. It's just not an approved test. And then the other thing is, so it's a 1 day in time deal. So if you test all those employees, is there any way to ensure that they're not going to travel anywhere? They're not going to be exposed to anyone else. They're not going to go to another state or on vacation. So then would we test everybody again in a week, 580 people? Who's going to pay for all of that? And then a week later, if everybody travels, are we going to test them again in another week? So that's a lot of it, is there's no actual medical protocol for how many times should we test them? Should we test all their families? Because what if their family's been exposed and they go home and come back to work? So the public health evidence-based approach is to isolate and quarantine. You isolate positives, you quarantine exposures. And so we follow evidence-based practices, and that's why. There's even Crawford County, almost 40,000 people. There would be no way to even feasibly test all of us, let alone at a state level. Now, the state is trying to reach 20% testing rate of the population. I think that they'll probably get there pretty quickly with everything going on. But like up in the other food plants, they're not testing their asymptomatic folks either. So a lot of it is just evidence-based medical practices. If there was a test developed that had the efficacy of being FDA approved for asymptomatic folks, then that would be great. That would be amazing, because that's not even available for influenza. It's been here for how many hundreds and hundreds of years. We've had rapid influenza screens, as long as I've been a nurse practitioner, for almost 24 years, and it's not recommended for asymptomatic folks either. So it's not cost effective, and I know there's a lot of controversy about that. Well, you could, but you just can't control then where all those people go, where their families go, and it's like, how long are we going to do that? Are we going to test everybody every day when they come into work? And who's going to do the testing? Who's going to pay for all the testing? And then when we get a false negative and somebody actually does have it, but it hasn't had it long enough, So that's why I think, and it's not just my opinion, that's what's been put out by KDHE as to why it's not recommended yet. And I don't know that the CDC's even recommended testing asymptomatic people. I've not seen that. I know the World Health Organization has put out test everyone. Okay, well, it's easy to say that, but in true theory, it's very difficult to do.
Well, there's some states, like the one I talked to you about the other day, trying to control when you have more restricted travel. People are there's too much movement around here.
Well, yeah, and it just
So
comes back to how you're
make-
going to control that.
It's a pinpoint in a day,
It
versus
is, it's one day in time.
where some communities are kind of protected because it takes initiative of a flight or a boat ride to get in there. They could do that, effectively
Right.
test before you get in there to protect those isolated pockets. But how many hundreds of people from out of state drive through Crawford County every day
Oh, yeah, I
that
mean, they
stop
come to our
to
businesses.
stop at businesses, and it's going to happen. So you got to treat everyone as if they've got it. You've got to be safe. It goes on your shoulders, not yours necessarily. It's
It's an individual choice.
It's up to me to keep
Right.
myself safe.
Absolutely, and we have said that all along, you know, it's up to the individual, and this, you know, Dr. Norman, the CDC, our state health department has said, this could last. This is not gonna be a short-term thing. This is probably gonna go on, you know, for a year, and when they do get an immunization, that's gonna be great and a treatment, but look at influenza. Does everyone get a flu shot? We have influenza outbreaks every year. So, I mean, we're not going to be able to close down our businesses and our societies for a year or two. It's just, I don't see how that would work. And not only that, then you get into the enforcement issues. How are you going to really keep people from traveling? You know, they have to go to work, they have to do all these other things, and you can't close essential functions. Well, we have a food plan. I mean, they're essential. So if people will wear the mask when they go out in public, if they will socially distance, if they're high risk, you know, stay home as much as possible. So it's an individual choice, but yeah, I mean, this could, and Dr. Norman, I think it was a webinar maybe I was on, I can't remember what it was on, but some outbreaks and pandemics last even longer than a year. If we lower the curve, we're not reducing the number. We lower the curve, we're just spreading it out longer, because then it's less traumatic to our healthcare system, to everybody. You know, there's less people in businesses sick at once. So we're flattening the curve, but we're really not reducing the number of positives. We're just spreading them out longer. So, I mean, really, people need to realize if you're worried, the only thing you can really control is what you do. So if you're worried, don't go to a crowded store. If you go in a business and it's crowded, leave. I have multiple times in several different places. Wear your mask, you know, do curbside pickup for groceries or takeout for food. People have asked me about community spread. Do I think we have community spread in Crawford County? Yesterday we had 20 cases, today 23 out of 40,000 people. I mean, I don't think so. We're still investigating all of these, but and really community spread is not really the issue. I mean, the issue is people taking the precautions, whether you have community spread or not. It's in Southeast Kansas. We have cases. Even people are going to go to, I mean, they went to the Lake of the Ozarks over Memorial. Use precautions, use common sense. So.
So I had a follow-up
Sure.
on so as far as, because you said we isolate,
Quarantine. Mhm.
people,
Yeah.
positives and exposures. So what is that looking like in the food plan? Like,
Yeah, so there's a lot. I mean, I don't have an exact number
so
because
we're quarantining like
Oh,
all
any
those people and the
exposures.
exposures?
all
that they've had?
exposures, yeah. All exposures are quarantined. So anybody that's positive, whether it's at the food plant or not, are isolated. So if you're sick, I for ill. If you're ill, you're isolated. That's what we call it. If you're exposed, you're quarantined. So yeah, and the plant has been very helpful in getting all they have video surveillance 24/7 throughout the entire plant. And so we have a contact up at corporate that is getting all the possible contacts. And I will say they wear PPP always. They have masks, gloves, full gowns because they are a food plant. So they are wearing the PPE all the time. And they have like their break room is limited. They have someone in there monitoring that people aren't like sharing food, that they're spaced out. They're screening all of their employees every single day. And I've said, I don't know how many times, maybe a million, that there is no way humanly possible to get our risk to zero. There's just no way. And so today we have 23 out of a population of almost 40,000. That is still very minimal compared to the counties that have had the, outbreaks. And we don't want that. That's why public health is, and I had a comment on Facebook that we are allowing, people to spread this virus if we don't shut down a food plant. And I just replied, we're not allowing anything. We are doing our job. I just think people need to be aware. Our epi nurses are working literally nonstop, all day long, all week long this week, to get a hold of all of these people. So, I just don't think things like that need to be put out on social media, because my epi nurses and my staff are working and dealing with the public, sometimes literally being cussed out on the phone by people
Yeah.
because they're
Right.
having to make people stay home because it's the law. And every single person in isolation and quarantine gets a legal order signed by me that they are legally quarantined and isolated. And not all health departments have done that from the beginning, but we have done that from the very beginning, even when we just had a couple. So, I would just appreciate if the public would realize that we are doing everything humanly possible. You can never get it to zero. Even if you would shut down a plant, there's no guarantee that people that work there wouldn't go shopping, because they're not all quarantined. They are not all quarantined because they're not all contacts. They may go to the store. They don't have to stay home. They're not in legal quarantine. So, I would just appreciate it if folks would realize that we really are working very hard to contain it.
I think probably a lot of it, Rebecca, is because they're scared.
Yeah.
Oh, I agree. And I even replied to that, we're all scared, but let's all remain respectful.
Absolutely.
We're all scared. I'm worried about it just as much as anybody, probably more than anybody. I don't sleep well. I'm worried about it too, but there's only so much humanly possible. And my recommendation on Facebook and to those folks that are scared is you got to take care of yourself,
Sure.
Stay home, wear your mask. I see people out with no masks. If you're scared, wear a mask. If you're worried, wear a mask. Don't go places. Stay home. There's lots of services that, like picking up food and delivery that you can use if you don't want to be exposed. So.
On switching to the metrics
Sure.
that we're looking at.
Uh-huh.
So just for public information, there are 4 of them.
Right.
And those are?
The death rate is one. The ability to test, hospital capacity, and ability to isolate and quarantine through public health.
I've had questions on the hospital
Mhm.
part. Do we know our total hospital capacity for Crawford County? Do we
Well,
have a number?
we have, both hospitals have bed capacity. So when we look at hospital capacity, it's not just beds that we're looking at. It's more like critical care beds. And when it comes to this type of thing, so with COVID-19 specifically, if you just had people from like a tornado or something, wounds and things like that, capacity would be completely different than something like COVID-19, which is a respiratory illness. So, we've talked about capacity before. We've not had any issue with ICU bed capacity to this point or ventilator capacity. And right now we're at full capacity. We don't have any patients in the ICU or on a ventilator in Crawford County because of COVID-19. I don't have an exact number, but the hospitals are well prepared for it. That's what they've been working the last 3.5, 4 months on is capacity. And I'm in contact with them almost every single day. I'm getting updates if they have anybody in the hospital, if they're in ICU or not, So I've not heard of any capacity issues, even like with Joplin or surrounding hospitals either. Yeah.
I guess I know there's not a magic number, but I'm just kind of
No.
wondering, because we know that when I've told people those are the metrics, they're like, so when is what's the tipping?
When we can't meet those.
So like when capacity is full, or like is there a trend?
Well,
that we're looking for, or-
and if we would start to get, say the hospital called me and said, hey, we've gotten several admits, we're really being taxed, that would be a red flag. If the hospital has their own metrics they follow as to at what percentage, they start to get, have a red flag go up. So at that point, I would be on the phone with KDHE. you know, if we were struggling with our ability to isolate and quarantine, I don't foresee that happening because KDHE has hired like 700 contact tracers that we can get help with isolating and quarantine. Right now, we're able just to do it. We have 7 epi nurses, so, I mean, we're lucky. And all of that's done over the phone, you know, so the biggest issue would be hospital capacity. So if they, you know, our medical system would become taxed, then that would be one of the number one red flags. The ability to test, I don't foresee that that's going to become an issue because the state's getting all, they just put out a new testing policy yesterday. I don't know if anybody saw the press conference. They're getting hundreds of testing supplies from the federal government. The death rate, you know, we have had one, and I'm not trying to minimize anyone dying. I mean, I don't want to see any deaths. We have had one, and I don't like that we've had one, but we've had nothing compared to some of the, you know, the counties and other states. We don't want to see any deaths, but the death rate would be something I would have to be in contact with KDHE about to see, you know, if we had another death, or if we had more than one, you know, what they think about that. We haven't had any others at this point, so. But it's not going to be, and pretty much every release from every county, even other states that I've seen, it's not going to be the number of positives we have that determine. It's going to be those 4 metrics. So as long as we're meeting those, you know, then I think we're going to be fine. And if our citizens aren't severely ill, and at this point they're not, so that's a good thing, you know.
Good thing.
Yeah, that's a good thing. I mean, you don't want to be sick, but it's good not to be severely ill.
All right.
So I don't know. Any other questions? I don't know if we got any emailed questions or anything.
I haven't, I've been checking
Okay.
periodically, and no, we haven't gotten any.
All right.
Cool. Thanks,
That
Rebecca.
was it?
Thank you, Rebecca.
Let's see. Rusty, you have anything to add to that? Randy? You good? Mike? Danny? All right. No, we appreciate everything you're doing. All right. Let's see, before we go on to new business, is there anything else to add? Go ahead. Hate to keep you captive.
I was just wanting to introduce you all to our new children's services director, Bill Howell. And Bill, he got moved down here at the end of April from Wyoming.
Oh, wow.
So he moved right in the middle of COVID, his family.
Heck of a time to relocate.
Yeah, heck of a time to relocate. He has relatives in the Springfield area, so that's what drew him back to this area. And so it's a convenient contact for him, and I'm really pleased to have someone to pick up the piece that I left off. So anyway, Bill Howell, and welcome him to the community. So,
You bet. Thank you very much.
Welcome.
Welcome.
Anyone else? All right, guess moving on to new business. Dawn?
And I don't know, Jim, did you want me to go through this authorized signature form? We have some items for the CDBG CV program that we need to get taken care of.
Thank you very much. Let us know
Thank
if you
you,
need
Rebecca.
anything.
I will. Thank you.
Thanks.
Get some items kind of signed off on and anyway, that authorized signature form is basically, we need to get approved and everybody's signature on it to get it on file for our CDBG CV, the coronavirus grant. And then I think also Jim has some other things that we want to go through. Do we want to approve these one at a time, probably?
I think we probably just need to approve the signature, authorized signature form, and then the, our grant agreement. And then, is there a separate agreement between us and regional planning? I think Susan had asked, I'm not sure if we have one or not, we would need to look into that. Just kind of an update, the grant kind of gets crazier and crazier. We had a meeting yesterday, which they had a Q&A online, and answered several questions from different cities and counties and members of regional planning commissions. And after that meeting, we started getting different answers to other questions. So one thing they said Thursday morning gets retracted Thursday afternoon. So we're still trying to figure out what's going on, and I think I'll go over these in a minute. I think if we can, it'd be nice to get Susan here Tuesday at the meeting with the Regional Planning Commission. She's helping to administer the grant. We'll be paying out the $12,000. She can help us with the plan and maybe answer any other questions we have, just to make sure we're on the right track as we go through the process. There's a lot of things going on to send out $120,000, but we have to meet that or we'll end up being responsible. So it's getting our committee in place, it's getting a plan in place, and Susan said she'd be happy to help us with that and anybody else that needed it. So I will see if I can get her to a meeting sometime next week.
Okay.
Okay.
So the signature form is real easy. And I think everybody's on there just to make sure they have signatures to any documents they need throughout the process, any checks, things like that. So if we want to approve that,
Do you
go
wanna
ahead to
make a
have
motion?
signed, yeah.
Mr. Chairman, I move we grant the authorized signature form pertaining to the CDBG-CV grant.
Second.
All right. Okay.
Okay, so then the larger item is the grant agreement between the Department of Commerce and the county. Some of the basics, if you go down to section 4, period of performance, agreement commences on June 15th, and it shall be completed by June 15th of next year, so we have a year to actually get everything we need. We're not in a hurry, so we have a little bit of time to plan and get our application ready, get our documents ready, get them out to the businesses, get our committee ready. We've got a little bit of time, so there's not any rush. We've got a year to spend the money. The compensation on Section 5, we will be receiving $132,000. Subsection B, there's no match. Grantee does not have to provide any money. Under C, $132,000 is all we will be receiving. They will not be paying us anymore. If we go down to second page under environmental review, from the call yesterday, it sounded like that is going to be pretty straightforward. I think we'll be exempt But we'll have to have a document for each business. We'll have to have an environmental review page for each business. But this project, we're not building a building where there has to have some kind of extra review studies. It's just handing out money. So there's no actual review. It's exempt, but it has to be in the program. There's just a lot of stuff that we've seen before. As you go through the pages, there's not really anything else that I want to call out. On page 6, under audit requirements, we normally have to do a single audit anyway because we receive over the $750,000 limit federal funds on a regular year. We'll be getting a lot more this year, so that's nothing new. It'll just be a larger single audit grant. And there's the same forms that we've always have to fill out for these types of grants. So to make sure there's no conflict of interest, which we have. There'll be, let me get to the end. So that's all the grant through page 8, the main documents. On the back, there's a special conditions. There's a certification regarding lobbying and then a budget. So the special conditions, really, it's everything we know and that Susan will help us walk through. But it also talks again about that we have to have an audit, that we have to have a final report by September 14th of 2021. We have to have all money spent by that June 15th deadline. So they have to be spent, everything has to be settled, and then we have some extra paperwork that we have to fill out. We're required to do quarterly progress reports that Susan will help us get out. And it sounds like the other page is this lobbying. We can't use this money to lobby. Then you see the budget at the back. So there's $12,000 for administration, and then we're able to spend $120,000 for businesses. So it sounds like the businesses will complete an application, and then if they're asking for payroll reimbursement, they can just send us in payroll figures. Or if it's actual money that they've spent, they'll send in receipts. So they'll actually have to have receipts or payroll documentation that we then forward on to the state for each business. So that's this document that we will need to sign and get back to Susan so she can send it in to the Department of Commerce. It's due, I think, July 2nd.
So the funds won't be available to our constituents until July?
I would say at a minimum, I'd say that's the earliest date will be in July. We just have to have everything in place before we start, and that means the committee, and that means the application, all these documents have to be back in. I don't think we can begin processing until July at the earliest. That's correct.
The application, will we put that online then?
Yeah, I'll be talking about that in a minute.
Okay.
Once we get this approved, I can get that set back in, then I'll talk next about the application.
So we need a motion on this? Or no?
Yes.
I'll move to approve the grant agreement for the CDBG-CB funding.
Authorizing the chair to sign.
Authorizing chair to sign.
Yes.
Second.
Aye.
Need two of those. Two of those are fine.
Okay.
And the lobbying sheet as well.
Yes.
Okay.
Okay. Speaking of the application, one of the questions that was asked yesterday was, do you have to use the application sent out by the state? You do not. We can format our own application, but if we do, we have to have everything that's on the state application, so
So just use the state application.
I'm not sure that it's, just to make sure that we're in compliance. I don't see any reason, unless we just want to make it look better,
I don't.
to use the state.
It's a formality right now, so. I don't
It
know why
is.
we just use the
It is.
state application.
In
Right.
addition to the application that I passed out Tuesday, Susan has been able to get, really, I'm not even sure if I need to pass it out. She's been able to get approved by the state, couple extra pages to the application. They'll make it easier for businesses to kind of see what they need to fill out, and that way we're not going back to them throughout to add more
Right.
information. So I think I think our application will be fine. Susan's been able to get some additional clarification, which they'll be able to get at anything they need, and then I don't think, otherwise we'd have to go back at the end and ask them for other information. One other thing that was not clear and is now clear is that if you as a business have received funding through some of these other programs that have been out there, word we had yesterday was you were not going to be eligible under this program. What we found out later in the evening, and Don sent that to me about 6 o'clock, is that you can be eligible if you received the Paycheck Protection. There's some other areas that are listed, but you cannot use it for the same thing. So that's why we have to track it. If you used PPP for payroll, you can use this money for inventory, for some other things. So
Is there a section on that form that asks
Yes.
that question?
there's a section on the form. So this is what Susan got approved, where you will fill out as a business if you've received money
Okay.
from these other categories. You get correct things.
Which one?
Okay, perfect, yeah.
They can go through and state,
That way they
that way
can't,
we have it all up front.
they can't double dip, or they can't say
Can't
they
double
didn't,
dip,
they can't
they
say they
can.
didn't know even, because it's right
Yes,
here. Okay,
it's right
perfect.
in there, so, by giving that to them ahead of time, we'll be able to know then, okay, they use another program, but they can use this program for something else, we can keep track of that, we're not trying to figure that out later.
So when you say we keep track of that, who's gonna do this part of it?
We initially will send out through the committee, send out the applications, but we'll be using Susan as well to help us out.
Okay.
So that as she's gonna administer the program, they're getting paid, regional planning. We're gonna lean on them to
Okay, that's what,
keep us compliant.
I was just make sure you weren't taking this on
Me?
all by yourself. You said we a lot, that's just checking.
We as a collective
The
planning
royal
commission. Yes, no, I don't want.
What are your thoughts on the committee? Do we have a committee established that this would roll right into within a county?
You know, we used to have an economic development committee, but I think it's been expired. It hasn't met for a few years. So no, I'd say no
Okay.
at this point.
I just checking, that'd be the easiest way.
Yeah, let's
that's
roll
what
it
I-
over.
Yeah,
I
because
think
it's
we'll
gonna
have-
be, I think it's gonna be harder to get a committee together than a person thinks. But,
Yeah,
Well, if that's the
So-
case, then we do it.
it may have to be. I mean, you'd hope you'd maybe get a banker
Right.
or some people that
Right.
would kind of be knowledgeable about
How many are we
distributing
how many are we
funds.
looking to get?
We talk 5
5 to 7, I think.
Yeah.
5
Yeah.
to 7? And try to reach out to every community. Okay.
And we do have an application on the website now. If you want to get that out to the community, we can. We're going to try and publicize as much as we can. If we're not satisfied with what we get, we'll just keep going until we get a committee that we're comfortable with. So
Okay.
there'll be a lot of help, so. Anyway, there's things happening. I've received more emails this morning on things that are happening, so it's probably best to get Susan here instead of me, letting you know what's actually going on with this grant.
So we're looking at actually July before
Before
you
we'll
will
get-
start filling out the application.
Yes, I believe so, for sure.
Are you on the same time frame, roughly?
Yeah, we had discussed it, decided it may be better on the city's
I think that's gonna be the hardest part. But, okay. But you thinking July as far as the city? I mean, I don't know how you're gonna throw it all together faster than that, but.
We've got the two, we're working with the meal side and economic development, so we're working with two different applications as far as what they will turn in. We've got a rough draft of what we're gonna use. We're not gonna use the state one. We've got what we're gonna be doing with it. Now we're working on an application for those who want to go into it.
Okay. All right. Anything else on that?
That's all I have for now. I think somewhere, well, I'll just visit with cities and I think maybe there's a contract between us and regional planning.
yeah.
To administer all this, we will hunt that down and have it for Tuesday.
I'd say it might be good to have her here to, if there's parts of that contract that there's questions on that would, she would understand that, that's what it's.
Okay, that's all I had on that.
All right.
Still, have you done?
I guess that's really all I had for new business. That's it.
Okay.
Okay, I'll keep going.
What do you got now?
This is something that we've actually talked about, but I was able to get a draft of an MOU
Oh,
and then send over to the city for approval, so the city's looked at this, added a couple changes, and they're ready to go, so.
Okay.
This will be for a storm siren in the Chicopee area, and the city wanted some kind of MOU between the city and the county to kind of set forth who was going to do what. So really, the city is responsible for sending out a signal that will hit the repeater and set off the siren. And what we've put in there is that the city basically will do that as they set off the rest of their sirens. So they're not going to be required to monitor just activity around the Chicopee area. When they regularly set off their sirens, and they'll be setting off this one too, Chicopee. So. Then the county will be responsible. Hopefully, we've got a lot of this donated, but we'll be responsible to make sure that it's up, that we upkeep and repair and get the repeater in and the tower. So I think the good thing about this is that when we have future locations that they're looking at, we'll just be able to plug those in and we'll have this already set up.
Yeah, I think it's good.
Mr. Chairman, if there's no further questions, I move that we grant the MOU between Crawford County and the city of Pittsburgh, authorizing the chairman to sign.
Second.
Two enough? Do you need three?
Two's plenty.
All right. Anything else?
That's all I have for me.
All right. Tom?
No, sir. All my questions have been answered.
Sure.
I do not have any new business.
The one thing I have for new business, the dust control keeps getting pushed back. So we talked about, I called Josh, I actually talked to Joker first this morning, talked to Josh about potentially setting up our tanker truck to be able to apply it. Because the big holdup is they have the rig they use to spray the roads, and that's what we're waiting for. To get the actual dust control is not an issue. So if we had our tanker truck set up to do it, we could set our schedule and actually stick to it. Right now, they dictate the schedule because they bring the application rig.
Who is it that,
Jim, we talked about, and there's only one other place we potentially go. It's Vance Brothers, and we don't even know if we can get it from them. It's an outfit in Kansas City, and I cannot remember the name of it.
I can't either.
So Josh is gonna look into it, and I think it'd be pretty minimal cost. It may not fix our problem this year, but next year, if
Get
we
the
have,
ground running, yeah.
if we have it, and we get rained out, it don't matter. We have our own equipment, and it's not.
right,
It'll be minimal cost, but Josh will look in to see what what it would take to convert that to use for that process. And then that way, we dictate the schedule. Right now, we're waiting on them to,
Right.
they keep pushing it back in a week, just like they did last year. Just like they've always have, like, it sounds like. But just to let you know, I called Josh on that, and
Good.
he's gonna figure out what it would take to do that, and then I'll hopefully have a cost. If it's something we wanna do, we can do. That's really all I had for new business, so. Old business done.
I have nothing, sir.
Jim?
Just real quick, and just really on the schedule, again, for the courthouse and for motor vehicle, I think we're going to continue on the same path now for probably a couple more weeks at least, maybe until the 4th, and see how things are going, but to keep the courthouse at 8 to 4, with closing at 4, which gives some time for catch up and then clean. I know, at least in the treasurer's office, motor vehicle, they've been very busy.
Okay.
And then still, people are able to, you know, they can, a lot of things they can do online, they can do through the mail, so we still encourage that. There's drop boxes here and at Pittsburgh, if they just want to come drop something off and not actually have to get into the building. But besides that, I think we'll keep the hours here from 8 to 4 and let people know that for at least a couple of weeks. And although I know the county treasurer eventually wants to get the Pittsburgh office back open. At this time, it's just not feasible, so they'll still be closed, probably at least till 4th of July.
And we still don't really know when the court's gonna
No,
open
we don't.
100%. so-
No,
Okay.
no, we sure don't.
All right.
So anyway, that's all I had.
Tom?
No, sir.
Jeremy?
Dawn, we talked briefly before the meeting about the phone system upgrade. Did you want to maybe talk about what that looks like, or where we're at, or what we're waiting on?
Well, I mean, we just need to, I guess, probably get Crocam back over here and get a understanding from all the offices of what equipment they need, and maybe, like we kind of were discussing, you know, things that happened since we
Right.
first kind of went into this, that maybe we need to look at the functionality of the phones we're putting in to be able to, you know, allow for work at home and things like that might be very
Who's been
good
your
to have in place.
Who's been your contact? Justin Schaefer?
Yeah, I'll get in touch.
See if he can set up a meeting with all the department heads and figure out what your needs are, and then
Yeah.
get the ball rolling, because it's on, I think they're covered up too with stuff to do. It'd be nice to get that done.
Yeah, that'd be our next step.
So,
I'll get in touch with him. That's
okay.
not hard to do, but make sure I make a note to call Justin and talk to him about that. But yeah, that's
But yeah, just let all the department heads know, and I guess if it's on a mesh with the Judicial Center down the road, I don't know if that's a MAC thing or how
I don't know that
how
it's
we include.
really, because theirs is in place, isn't it? Or-
Right.
Yeah.
Well, not yet. Were they gonna?
Oh, is it not?
I don't know if that ever went through.
I thought it did.
Did it? Okay.
Yes,
I know they were still in that contract with the other company for a period of time,
that's correct.
and that's why.
Well, we'll find out.
I mean,
Yeah.
just to make sure that everything's on a mesh, because that's the whole, and maybe the sheriff's department, make sure everything's on a,
Definitely the sheriff.
all their needs are gonna be met at one time, and, because
Right.
that's the
I
whole
can
purpose
find
of doing
out
that.
from Justin as well, because
Okay.
he was kind of the point man for.
Right, but if
Crocam.
it's worth the upgrade, because it solves the problem, do this COVID-19 stuff, now's the time to do it.
I mean, we've been using these for 25 years, so I would say go with the upgrade.
Okay.
So we'll have this for, it's worth it.
Yeah,
It'll be worth
Right.
and it saved money anyway, so
it.
that's,
It's possible.
anytime you can save money, you gotta do it.
Absolutely.
Right.
Oh, that's all
Anything
I
else?
had for old business.
All right, Yes, future business, June 16th, work sessions with department heads regarding 2021 budget requests beginning at 8:30. Under announcements, the courthouse in Girard is open to the public from 8 a.m. to 4 p.m. starting June 1st, 2020 until further notice. The motor vehicle office at the Judicial Center in Pittsburgh will remain closed, but residents may use the drop box at the security desk at the Judicial Center for motor vehicle and tax payments to be processed at the courthouse. Any other business?
Mr. Chairman, if there's no further business, I'll move we adjourn.
Second.
There's all your stuff, Jim. Oh, boy. Sitting kills me.
What's that?
Sitting kills me. Absolutely.
Get a standing desk for the commissioners.
I'd be shuffling.
Are we off done? Are we off done?
Restless legs have